Welcome, deep divers. Have you ever stopped to think about what might genuinely challenge someone who seems to have absolutely everything?
Mm-hmm.
You know, global fame, a huge career, that kind of public image.
Mm-hmm.
Well, today we're kind of pulling back the curtain on a story exactly like that. It's about a global supermodel, someone whose glamorous life uh, actually hides this deep, decade-long struggle with a really persistent and, frankly, often misunderstood illness.
It's a really compelling angle to start with.
Right. What kind of unseen battle could impact someone like that so profoundly, affecting their daily life, their career for years?
And that question leads us straight into our deep dive today. We're going to try and unpack the complexities of Lyme disease.
Lyme disease.
Yeah. And it's really not just a simple bacterial infection. I mean, it is, but it's way more intricate than most people think. It often gets dismissed as, just the result of a tick bite.
Right, like, oh, you got bit by a tick. End of story.
Exactly. But its journey through the body, the huge range of symptoms it can cause, and the real challenges it throws up for diagnosis and treatment. It's anything but straightforward. Lyme disease is kind of an elusive enemy. People call it the great imitator for a reason.
The great imitator.
Yeah.
Like that. Because it mimics other things.
Precisely. Which makes understanding its nuances absolutely critical.
Okay. So our mission today for this deep dive is to really get beneath the surface of Lyme disease. We want to look at everything, its origins, how it shows up, stealthily sometimes, the big hurdles in diagnosing and treating it, and crucially, the human side of it, the experience behind the illness.
Yeah, the lived reality.
Exactly. And we'll be looking at it particularly through the lens of Bella Hadid's very public battle. Her story really brings this complex medical challenge to life, doesn't it?
It really does. It provides a very visible anchor.
Our goal here is to distill the most important insights so that you, listening, walk away not just sort of knowing about it, but really feeling well-versed in what Lyme disease actually involves.
And getting that understanding is incredibly relevant for you, our listener. I mean, Lyme disease isn't some niche concern anymore. It's not just for certain regions or, hikers.
Right. It feels like you hear about it more and more.
It's a growing public health issue. It's frequently misdiagnosed, and it can seriously impact lives all over the world. Knowing its subtle points, understanding the diverse symptoms, grasping the challenges, it empowers you.
How so?
Well, it helps you recognize potential signs, maybe advocate more effectively for your own health or for people you care about. And it builds empathy, for the many people dealing with chronic illness that isn't always obvious on the outside.
Yeah, the empathy piece is huge.
We really want to provide those aha moments today, the ones that demystify Lyme disease, turning what feels like this vague, scary threat into something you can actually understand.
Okay, let's do it. To really get a handle on this invisible enemy, let's start with the basics. What is Lyme disease, fundamentally? What makes it such a tricky opponent?
Well, at its absolute core, it's a bacterial infection. Simple as that on one level. It's caused specifically by a type of spiral-shaped bacterium, a spirochete called Borrelia burgdorferi.
Borrelia burgdorferi, got it.
But, and this is a big but, it's crucial to understand that Borrelia burgdorferi isn't like your average bacterium. It's not like, say, strep or E. coli, things we're more familiar with, perhaps.
How is it different?
It has some really unique tricks up its sleeve, you could say. Properties that directly contribute to how complex the disease is and why it can persist. For example, think about how our immune system usually works. It spots an invader, mounts a strong response, remembers it, clears it out.
Right, develops antibodies.
Exactly. But Borrelia is like a master of disguise. It uses this clever strategy called antigenic variation. It can actually change the proteins on its outer surface quite frequently.
Seriously? So the immune system keeps having to learn it all over again.
Pretty much, it makes it incredibly difficult for our immune system to develop a lasting memory and effectively fight it off. It helps the bacteria evade detection and clearance.
Wow. That's sneaky.
It really is. And there's more. Borrelia can also form these protective structures called biofilms inside our tissues. You can think of them like tiny fortresses.
Biofilms. Like a protective slime layer.
Kind of, yeah. These structures shield the bacteria from both our immune cells and from antibiotics. This allows it to establish persistent infections, making it much harder to completely eradicate.
Okay. So it can hide and change its appearance. That explains a lot about why it might stick around.
Precisely. That adaptability, that stealth, is what allows it to move beyond the initial bite site, spread through the body, and cause this really wide array of problems that can unfortunately become chronic.
That's fascinating and honestly a bit unsettling for a bacterium. So this incredibly sneaky little organism is so good at dodging our defenses. How does it actually get into our bodies to begin with? It's all about the pick, right? The vector.
It is, yes. Transmission is exclusively through the bite of infected ticks, specifically ticks belonging to the Ixodes genus.
Adhesodes. Are those the ones people call deer ticks?
Yep, deer ticks or black-legged ticks, depending on where you are. Understanding their life cycle is pretty key here. They go through 4 stages: egg, larva, nymph, and adult.
Okay.
And it's mainly the nymph and the adult stages that transmit Lyme to humans. Now, the nymphs, they're the really tricky ones
Why is that?
because they are incredibly small. We're talking roughly the size of a poppy seed.
A poppy seed? Wow.
Yeah, which makes them unbelievably difficult to spot on your skin. So many, many bites from nymphs go completely unnoticed.
I can imagine. You wouldn't feel that necessarily.
Probably not. Now, for transmission to actually happen, the infected tick needs to be attached and feeding for a certain amount of time.
Ah, right. I've heard this. It's not instantaneous.
No, not usually for Borrelia burgdorferi. Typically, it takes somewhere between 24 to 48 hours of attachment.
Okay. Why so long?
Well, the bacteria mostly hang out in the tick's midgut. They need time to sort of wake up, multiply, migrate to the tick's salivary glands, and then get injected into the host's bloodstream as the tick feeds.
So there's a window of opportunity there.
Absolutely. This time-dependent transfer is why finding and removing a tick promptly is so incredibly critical. If you can get it off within that first 24 hours, you significantly reduce your risk of getting infected. Doesn't eliminate it entirely, mind you, but drastically lowers the odds.
That is such a vital piece of information. And yeah, underestimating the stealth of these things. A poppy seed-sized nymph. That's almost impossible to find if you're not looking really, really carefully.
Exactly. Their tiny size means they're just so easy to miss, especially if they latch on in spots you don't easily see, like your scalp, behind your ears, armpits, groin, behind the knees, in skin folds.
Yeah, places you might not check routinely.
Right. And often the person has no idea they were even bitten, let alone that a tick was attached long enough to transmit anything. This silent transmission is a huge factor in why diagnoses often get delayed.
When did we even figure all this out? When was Lyme disease first identified?
That happened back in the mid-1970s. There was this unusual cluster of what looked like juvenile rheumatoid arthritis cases in children, all centered around the town of Lyme, Connecticut.
Hence the name.
Exactly. Researchers, particularly Dr. Alan Steer and his colleagues, investigated and eventually connected the dots between these arthritis cases, a specific tick vector, the Ixodes tick, and eventually, in the early 80s, Dr. Willy Burgdorfer identified the spirochete bacterium responsible.
Wow, so it took a while to piece it all together.
It did. It was groundbreaking work, linking a specific bacterial infection to an arthropod vector and this wide range of debilitating symptoms. It really laid the foundation for everything we understand now.
It's incredible how these tiny biological interactions have such massive consequences.
Mm.
And I'm always fascinated by where these things live. Ticks aren't just everywhere, right? They have preferred hangouts.
Yeah.
So where are we most likely to bump into these ixos ticks? Where is Lyme most common?
You're right. Their habitat preferences directly shape where the disease is most prevalent. These ticks really thrive in specific environments. Think wood areas, tall grasses, and especially the leaf litter you find on forest floors.
Leaf litter. Okay, didn't think of that specifically.
Yeah, it provides moisture and protection. These places offer the perfect conditions for tick survival and give them easy access to their main hosts like deer, mice, other small rodents. These animals are crucial for the tick's life cycle and, importantly, they act as reservoirs for the Borrelia bacteria.
So the ticks pick it up from the animals.
Exactly. Geographically, Lyme disease is what we call highly endemic, meaning it's consistently present in certain well-defined regions. In the U.S., the hotspots are definitely the Northeast, the Mid-Atlantic states, and the North Central states like Wisconsin and Minnesota.
Okay, the classic Lyme areas.
Right. But it's definitely not just a North American thing. It's a major public health concern across big parts of Europe, too. And interestingly, in Europe, they often deal with different species of Borrelia, like Borrelia hazelia and Borrelia guarini, which can sometimes cause slightly different patterns of symptoms.
Oh, that adds another layer of complexity.
It does. And Lyme is also found in parts of Asia. But here's the really crucial thing to understand now. The map is changing.
How so?
Well, thanks to factors like increased international travel, shifts in land use, humans moving further into natural habitats, and definitely the impacts of climate change, warmer winters, changing rainfall patterns.
Yeah, climate change affects everything.
It really does. And it's allowing the geographic range of these ticks, and therefore Lyme disease itself, to expand. We're seeing cases pop up more frequently in areas that maybe weren't considered high risk 10 or 20 years ago. The whole epidemiological landscape is shifting.
So it's definitely not just a problem for people living in, say, New England anymore, or just for hardcore hikers. It's becoming a much broader issue.
Precisely. And that's why the perception needs to catch up. It's fascinating and honestly a bit concerning how often people still think of Lyme as this rare, almost exotic disease. Maybe something that only affects a specific type of person in a specific rural setting.
Yeah, I think that perception exists.
But the reality, its prevalence is increasing, its geography is expanding, and it's hitting diverse populations across wider areas. For instance, those different Borrelia species in Europe I mentioned. Borrelia hazelia is often linked more with skin issues, like a condition called acrodermatitis chronica atropicans, while Borrelia guarini is more frequently associated with neurological problems.
So the specific strain matters too.
It can influence the presentation, yes. It just highlights the diversity within this bacterial family. The main takeaway is that both the public and the medical community really need to recognize Lyme as a significant, common, and growing public health challenge, not a niche concern.
Okay, so we've got a grasp on this invisible enemy, how it gets in, where it hangs out. Now, the next really critical piece is exploring how this incredibly sneaky illness actually shows up in the body. The symptoms, the stages. This brings us to what you call the chameleon of illness. Why that name? Why is Lyme the great imitator?
It earns that nickname because its symptoms are just so incredibly varied. They can look exactly like the symptoms of countless other conditions.
Like what? Give us some examples.
Oh gosh. Fibromyalgia, chronic fatigue syndrome, rheumatoid arthritis, multiple sclerosis, lupus, even psychiatric conditions like depression and anxiety, or even early ALS sometimes. The list goes on.
Wow, that's a huge range.
It is. And this incredible variability, this lack of really specific, unique symptoms in many cases, is a core reason why diagnosis is so challenging. For patients, figuring this out, realizing their unexplained symptoms might actually be Lyme, can be one of those huge aha moments after potentially years of searching for answers.
I can only imagine the frustration leading up to that. So, how does it typically progress? Are there defined stages?
Generally, yes. We talk about it progressing through stages, though it's important to remember not everyone experiences every single symptom, and the progression isn't always neat and linear. But broadly, we look at 3 stages: early localized, early disseminated, and late disseminated.
Okay, let's break those down. Stage 1, early localized. This happens pretty soon after the bite, right? Days to weeks.
Correct. Usually within about 3 to 30 days after the tick bite, this is when the infection is still relatively close to the bite site.
And this is where that famous bullseye rash comes in.
Yes, the erythema migrans, or EM rash. It's often the first and most distinctive clinical sign. It typically shows up at the site of the bite.
Describe this for us. What does it actually look like?
The classic description is a red, expanding ring of redness, often with some central clearing, making it look like a target or a bullseye. It usually expands gradually over days and can get quite large, sometimes several inches across. It might feel warm to the touch, but interestingly, it's usually not itchy or painful.
Not itchy or painful. That seems counterintuitive for a rash.
It does, and that's another reason it can be missed. If it's not bothering you and maybe it's on your back or somewhere you don't see easily, you might not notice it.
So that bullseye, while it's the classic sign, it sounds like it's also one of the trickiest parts of early diagnosis because it doesn't always, follow the rules. I've heard not everyone even gets one.
You've absolutely hit on a critical point. While we talk about the classic bullseye, it is so important to stress that not everyone gets this rash. Estimates vary, but studies suggest maybe only 50% to 70% of people infected with Lyme actually develop an EM rash.
Only half to maybe 3/4. That's way lower than I thought.
It is. And even among those who do get a rash, it doesn't always look like that perfect bullseye. It might just be a solid, uniformly red patch that's expanding, or it could look more like a bruise, or sometimes even have blistering or a bluish-red center.
So it can look like a lot of other skin things.
Exactly. Plus, as we mentioned, it often appears in less visible places: scalp, armpit, groin, behind the knee, on your back. Areas where you might easily miss it, especially if you're not doing those thorough tick checks. The absence of a rash or an atypical rash is a major reason why early diagnosis gets missed so often.
Okay, that's huge. So you definitely can't rely on seeing a bullseye rash to know if you have Lyme. What else happens in this early stage? Even if you don't get the rash, you can still feel sick, right?
Oh, absolutely. Alongside the rash, or sometimes even without any rash at all, many people develop flu-like symptoms.
The non-specific stuff again.
Exactly. We're talking about things like a mild fever, chills, headache, feeling really tired, like an unusual fatigue that doesn't get better with rest.
The deep fatigue.
Yeah, profound fatigue. Plus muscle aches and often joint pain that seems to move around. Like one day your knee hurts, the next day it's your shoulder. Migratory pain.
Okay. But all of that just sounds like the flu. Or maybe you just overdid it at the gym.
Precisely the problem. These symptoms are so common, so nonspecific, they get dismissed all the time. Oh, it's just a summer cold, must be the flu going around, I'm just run down, especially if it happens during flu season. The absolute key here is connecting these seemingly ordinary symptoms to the possibility of a tick exposure. Even if you don't remember being bitten, even if you didn't see a rash, making that potential connection is vital for getting checked out early.
Because early treatment makes a huge difference.
A massive difference. Catching it in this early localized stage gives you the best chance for a quick and complete recovery with a standard course of antibiotics.
Okay. So what happens if that early stage isn't recognized or maybe isn't treated effectively? The bacteria don't just stay put, right?
No, unfortunately not. If that initial infection isn't cleared, the Borrelia bacteria can start to spread or disseminate from the bite site. This brings us to stage 2, early disseminated disease.
And when does this typically happen?
Usually weeks to months after the initial tick bite, the bacteria use the bloodstream and the lymphatic system as highways to travel to other parts of the body.
Okay, so it's going systemic now. What kind of symptoms show up then?
Well, you might actually see more rashes appear. Multiple smaller EM rashes can pop up on different parts of the body, which is a clear sign the bacteria are spreading. But often the more concerning symptoms in this stage involve the bacteria reaching vital systems. They seem to have a preference for certain tissues.
Like the nervous system. That sounds incredibly serious.
It can be, yes. Neurological involvement is quite common in this stage. One of the hallmark signs can be facial palsy, often called Bell's palsy.
Where one side of your face droops.
Exactly. Sudden weakness or paralysis on one side of the face can be really alarming. Another serious possibility is meningitis inflammation of the membranes around the brain and spinal cord.
Okay, that's definitely serious. What are the signs of that?
That would typically involve a severe headache, a really stiff neck, and often sensitivity to light. You might also get what's called radiculopathy.
Radiculopathy. What's that?
That's inflammation of the nerve roots where they exit the spinal cord. It can cause shooting pains, numbness, tingling, or even muscle weakness in the arms, legs, or trunk. Basically, nerve pain radiating out.
Wow. So the bacteria are directly impacting the nerves.
They can, yes. The good news is, if Lyme is diagnosed and treated with appropriate antibiotics at this stage, even with these neurological symptoms, the prognosis for recovery is generally quite good. But you need to catch it.
And it's not just the nervous system, right? The heart can get involved too. That sounds terrifying.
It absolutely can be, although thankfully, significant heart involvement, known as Lyme carditis, is less common than the neurological issues. But it does happen.
What does it do to the heart?
The bacteria can interfere with the heart's electrical system. They can disrupt the signals that control your heartbeat, leading to what's called heart block.
Heart block. Like the signal isn't getting through properly.
Exactly. It can range from mild slowing of the electrical conduction to, in more severe cases, a complete block where the upper and lower chambers of the heart aren't communicating electrically. This can cause symptoms like palpitations, feeling dizzy or lightheaded, shortness of breath.
Okay, those are definitely symptoms you shouldn't ignore.
Absolutely not. If we connect this to the bigger picture, this really highlights the bacteria's surprising ability to invade and affect vital systems throughout the body nervous system, cardiovascular system. It really underscores why getting that early treatment is so urgent. If left untreated, these disseminated problems become much harder to manage, and in very rare cases, severe Lyme carditis can even be life-threatening.
And what about the joints at this stage? Does the pain get worse?
Yes. Typically, the joint pain and swelling that might have started subtly in stage 1 can become more severe, more frequent, and still often migratory, jumping from joint to joint, especially the large joints like the knees.
Okay, so if it's still missed, or maybe treatment wasn't fully effective, that leads us to stage 3, late disseminated disease. Now we're talking months, maybe even years after the initial bite.
Correct. Months to years later. This is where the illness can become truly chronic and debilitating, profoundly changing someone's life.
What are the main features of this late stage?
One of the classic manifestations is Lyme arthritis. This isn't just fleeting joint pain anymore. It's characterized by persistent, recurring episodes of severe joint swelling and pain.
Mostly in the knees, you said.
It most commonly affects one or a few large joints, and the knee is by far the most frequent target. But other large joints like the shoulder, elbow, ankle, or hip can also be involved. This arthritis can cause significant pain, limit mobility, and lead to chronic inflammation in the joint.
That sounds incredibly painful and limiting. But maybe even more impactful are the neurological problems that can become chronic. You mentioned neuroborreliosis.
Yes, neuroborreliosis specifically refers to the situation where the Borrelia bacteria are actively affecting the central or peripheral nervous system in this later stage. And the symptoms here can be incredibly pervasive and disabling.
And this is where we hear about things like brain fog. That
Right.
term comes up so much with chronic Lyme. It sounds awful.
It is. Brain fog is an extremely common description, and it really captures a collection of cognitive impairments that are profoundly debilitating. We're talking about serious memory problems, short-term memory loss, difficulty recalling words.
Like words are just out of reach.
Exactly. Trouble concentrating, reduced mental clarity, feeling like you're thinking through mud, just a general mental sluggishness. People describe feeling like their brain just isn't working right, struggling with tasks that used to be easy, finding it hard to process information or focus.
That must be incredibly frustrating and scary.
Deeply. It can dramatically impact your ability to work, to study, to socialize, even just to manage everyday tasks and conversations. And alongside the brain fog, you can also have chronic neuropathic pain.
More nerve pain.
Yes, similar to what can happen in stage 2, shooting pains, numbness, tingling, but often it becomes more widespread, more persistent, more intense in this late stage. And then there's the fatigue.
Still fatigue.
Yes, but often it's a severe, disabling fatigue. The kind that isn't relieved by sleep, that just utterly drains you and drastically limits your activity level and quality of life.
So putting it all together, what does this mean for someone living with late-stage Lyme? This is where it becomes truly life-altering, isn't it? Transforming daily existence.
Absolutely. It can become a constant battle against pain, exhaustion, cognitive difficulties. It permeates every aspect of life.
And this brings us to something that generates a lot of discussion, sometimes confusion, even controversy, post-treatment Lyme disease syndrome, or PTLDS. Some people call it chronic Lyme. What exactly is that?
Okay, this is probably one of the most challenging and frankly least understood aspects of Lyme disease, both for the people experiencing it and for the medical community trying to help them. PTLDS is the term used to describe the situation where some individuals continue to have significant debilitating symptoms after they've completed the standard recommended course of antibiotic treatment for Lyme disease.
So the antibiotics didn't cure them. The symptoms stick around.
Essentially, yes. We're talking primarily about that triad of extreme fatigue, widespread muscle and joint pain, and those cognitive issues, the brain fog. These symptoms can persist for months, sometimes years, or even longer, long after the initial infection is presumed to have been cleared by the antibiotics. It profoundly impacts their quality of life.
Why? Why do the symptoms continue if the bacteria are supposedly gone?
And that is the million-dollar question, and where the nuance, the debate, and the ongoing research come in. The exact cause of PTLDS isn't fully understood. There's no single universally accepted explanation, and it's an area of really intense medical investigation and sometimes disagreement.
So even after you've been treated, the struggle can just continue. with no clear answers why. That sounds incredibly isolating and frustrating.
It is immensely so, and this lack of a clear biological marker or universally accepted cause contributes to the controversy. You often have different medical perspectives clashing.
How so?
Well, you might have infectious disease specialists who primarily look for active, ongoing infection, and the standard Lyme tests might be negative after treatment. So, from their perspective, there's no active infection to treat with more antibiotics. Then you might have rheumatologists or neurologists who are more familiar with post-infectious syndromes, where inflammation or autoimmune processes can linger long after the initial trigger the infection is gone.
So different ways of looking at the same problem.
Exactly. And this often leaves patients caught in the middle, feeling dismissed, or like their very real debilitating symptoms aren't being taken seriously because there isn't a straightforward test result or a clear-cut treatment pathway agreed upon by everyone.
That's awful. So what are the theories? What might actually be going on in PTLDS?
Research is exploring several possibilities. One leading idea is that maybe it's not an active infection causing the ongoing symptoms, but rather an aberrant immune response. Perhaps leftover fragments of the bacteria, even dead ones, continue to trigger inflammation. Or maybe the initial infection kickstarts an autoimmune process in people who are genetically predisposed, where the immune system mistakenly starts attacking the body's own tissues.
So the body keeps fighting, even after the enemy is gone.
Kind of like fighting a ghost of the infection, yes. Another area is looking at whether Borrelia might be really good at hiding. We talked about biofilms, or maybe it hides out in places where the immune system or antibiotics don't reach well, like certain parts of the nervous system or joints, leading to a very low-level persistent infection that our current tests just can't reliably detect.
Still hiding, even after treatment.
It's a possibility being investigated. Other research is looking into how the initial infection might disrupt things long term, like maybe altering the gut microbiome or impacting mitochondrial function, the energy factories in our cells, which could contribute to the chronic fatigue and pain.
So many potential avenues. It really highlights the complexity.
It absolutely does, and it raises this really important question. How do we best support people whose lives are devastated by these persistent symptoms when the conventional treatments have been given and the science is still evolving? It really underscores the desperate need for more research, for better diagnostic tools for persistent infection or post-infectious states, and for a more holistic, patient-centered approach to care. One that validates the person's experience, focuses on managing symptoms, and supports their quality of life, even when we don't have all the answers about the underlying cause.
And this situation, this experience of persistent symptoms after treatment, is exactly what people like Bella Hadid have brought into the spotlight, right? Making her story incredibly relevant here.
Precisely. Her public discussion about her ongoing struggles really embodies this complex and often difficult reality of PTLDS or chronic Lyme.
This whole complicated picture brings us straight to Section 3, the quest for clarity, diagnosis, and treatment. Given everything you've just described, the chameleon symptoms, the stages, the controversy around persistence, it sounds like just getting diagnosed in the first place must be a massive challenge.
It is, without a doubt. It's one of the biggest hurdles in dealing with Lyme effectively. The diagnostic process can be incredibly tough for a whole bunch of reasons that pile up.
Like the symptom overlap we talked about.
Exactly. As we've covered, the symptoms, especially early on, the flu-like stuff, the rash that might not look typical or even appear at all, they overlap with so many other common illnesses. It's very easy for a doctor or the patient themselves to initially think it's something else entirely, especially if they don't specifically think about tick exposure.
Right. If you live in a city and get flu-like symptoms in winter, Lyme isn't the first thing that jumps to mind.
Probably not. So the patient might not mention a possible tick bite from months ago, or maybe they never knew they were bitten. That connection just doesn't get made, and the search for a Lyme diagnosis gets delayed, sometimes for a long time.
And the testing.
Yeah.
You mentioned it's not straightforward either. It's not like a simple strep test where you get a clear yes or no quickly.
No, definitely not. That's another major source of confusion and frustration. The standard way we test for Lyme involves a two-tiered process, usually recommended by bodies like the CDC.
2 tiers. How does that work?
Okay, so first, you typically do a screening test called an ELISA, which stands for Enzyme-Linked Immunosorbent Assay. This test looks for antibodies your body might have made against the Borrelia burgdorferi bacteria.
So it's looking for the immune response, not the bacteria itself.
Correct. Now, the ELISA test is quite sensitive, meaning it's good at picking up potential cases, but it's not very specific, meaning it can sometimes be positive even if you don't have Lyme, maybe due to cross-reactivity with antibodies to other infections.
So it can give false positives.
It can. That's why if the ELISA comes back positive or even borderline equivocal, the recommendation is to then perform a second, more specific test called a Western blot.
Western blot. Okay. What does that do?
The Western blot looks for antibodies against several specific proteins found on the Borrelia bacterium. It's looking for a specific pattern of reactivity. We typically look for two types of antibodies, IgM, which usually show up earlier in the infection, and IgG, which develop later and can stick around for a long time.
So ELISA first, then Western blot if the ELISA's positive.
Yeah.
Sounds logical, but you said there are limitations.
Yes, significant limitations. One huge one is the window period.
Window period.
Yeah. In the first few weeks of infection, your body might not have produced enough antibodies yet for either the ELISA or the Western blot to detect them. So you could be genuinely infected with Lyme, but the tests come back negative.
A false negative.
Exactly. A negative test early on absolutely does not rule out Lyme disease. This is a critical diagnostic gap. If a doctor relies solely on a negative test in those first few weeks, they could miss the chance for early treatment when it's most effective.
Wow. That's a major pitfall. Are there other issues with the tests?
Yes. Another big one is that antibodies, especially the IgG type, can stay positive in your blood for months or even years after you've been successfully treated and the infection is completely gone.
So a positive test doesn't automatically mean you currently have Lyme.
Correct. It could just mean you had it in the past. This makes it really difficult for doctors to use the test to distinguish between an active, ongoing infection versus a past, resolved infection. And it makes it very hard to know if someone's persistent symptoms, like in PTLDS, are due to ongoing infection or something else because their antibodies might stay positive regardless.
So let me get this straight. Early on, you could have Lyme, but the test says negative. Later on, you could not have active Lyme anymore, but the test says positive.
That's a pretty good summary of the challenge, yes. It's a real puzzle.
It sounds like interpreting these tests requires a lot of clinical context, not just looking at the results.
Absolutely crucial. This is why a doctor's comprehensive judgment is so important. They need to consider the patient's symptoms very carefully, get a detailed history, asking specifically about potential tick exposure, where they live, travel history, when symptoms started, and then use the lab results as just one piece of the puzzle, especially early on.
So, like, if someone lives in a high-risk area, spends time outdoors, and shows up with that classic EM rash in the summer.
Many clinicians in that scenario would make a clinical diagnosis and start treatment with antibiotics right away based on the rash and the history, even without waiting for blood tests, because the rash itself is considered diagnostic in that context, and waiting for tests could delay treatment unnecessarily.
That makes sense. Don't wait if the picture fits.
Right. They also need to consider other tick-borne diseases because ticks can carry multiple infections, co-infections like babesiosis or anaplasmosis, which can complicate the symptom picture and require different treatments. So it's not just about the lab numbers, it's about putting the whole clinical story together.
It really sounds like a puzzle that requires a lot of different pieces, and sometimes those key pieces are missing. Or maybe they're even a bit misleading. So once a diagnosis is made, hopefully early, what's the standard treatment? How do we fight this thing?
Fortunately, when Lyme is diagnosed, especially early, antibiotics are the cornerstone of treatment and are generally very effective.
Which antibiotics?
The specific choice depends mainly on the stage of the disease, the symptoms, and the patient's age. For early stage Lyme, that stage 1 we talked about, maybe with the rash or flu-like symptoms, the most common choice for adults and kids over 8 is doxycycline.
Doxycycline, okay.
For younger children or for pregnant or breastfeeding women, amoxicillin or ciprofloxacin are often used instead because doxycycline can have side effects like tooth staining in young kids.
How long do you typically take them for?
For early, uncomplicated Lyme disease, the usual course is about 2 to 4 weeks of oral antibiotics. Somewhere in the 10 to 21 day range is very common, depending on the specific drug and the clinical picture.
And is that usually enough? Does it lead to a full recovery generally?
The really good news is that, yes, for the vast majority of people who are diagnosed and treated early with that standard antibiotic course, they recover completely and have no long-term problems.
That's incredibly reassuring.
It is. The key takeaway here, and we can't stress it enough, is that prompt treatment is absolutely crucial. The earlier you diagnose and treat Lyme, the faster and more likely a full recovery is.
Okay. What about if it's diagnosed later in stage 2 or 3, or if there are more severe complications like the neurological or heart issues?
Right. For later stage disease, or more severe disseminated Lyme involving the nervous system or the heart, longer courses of antibiotics are often needed. And sometimes, particularly for significant neurological involvement, like meningitis or severe Lyme carditis, intravenous IV antibiotics like ceftriaxone might be necessary. This often requires treatment in a hospital setting, at least initially.
So more intensive treatment for more advanced cases.
Exactly. The goal is always to eradicate the bacteria and try to prevent or minimize long-term damage to tissues and organs.
And what about for people experiencing PTLDS? If standard antibiotics are done, what's the approach then?
That's much more complex given the uncertainty about the cause. Since more antibiotics haven't been consistently shown to help PTLDS in major studies and can carry risks, treatment usually shifts towards managing the specific symptoms.
Like managing the pain, the fatigue, the brain fog.
Precisely. This might involve medications for pain relief, strategies to improve sleep, perhaps physical therapy to maintain function, maybe cognitive rehabilitation techniques for the brain fog, and definitely psychological support to cope with the challenges of chronic illness. It becomes more about improving quality of life and function rather than targeting an active infection. Some people also explore complementary or alternative therapies, but it's important to note that many of these lack strong scientific evidence from rigorous clinical trials.
Okay, so effective treatment exists, especially early on, which is great news.
Mm-hmm.
But as the old saying goes, prevention is better than cure, right? Especially with something this tricky. What can you, listening, actually do to protect yourself from getting bitten by these ticks in the first place?
Absolutely. Prevention is your best weapon, and there are several really practical, actionable steps you can take. These put the power back in your hands.
Okay, let's hear them. What's step 1?
Step 1 is tick avoidance. Know where ticks live. We talked about wooded areas, tall grass, leaf litter, brushy areas. When you're hiking or walking in these kinds of places, especially during peak tick season, which is generally spring, summer, and fall, but can be year-round in warmer climates.
Right. They can be active whenever it's not freezing.
Exactly. So try to stick to the center of trails. Avoid wading through dense vegetation or sitting directly on the ground or on logs covered in leaf litter.
Okay, stay on the path. What about clothing? Does that help?
It makes a huge difference. This is step 2. Protective clothing. When you know you'll be in tick territory, wear long-sleeved shirts and long pants. Tucking your pant legs into your socks or into your boots creates a really good physical barrier.
Looks a bit dorky maybe, but effective.
Totally effective. It makes it much harder for ticks crawling up from the ground to actually reach your skin. Also, wearing light-colored clothing can make it easier to spot ticks that might have hitched a ride.
Good tip. Okay, avoidance clothing. What about repellents? Do they work? Which ones?
Yes, repellents are highly effective when used correctly. This is step 3. Look for repellents registered with environmental protection agencies, like the EPA in the U.S. Ones containing DEET are very effective. Picaridin is another good option, often considered less greasy or odorous than DEET. These can be applied directly to exposed skin.
DEET or picaridin on skin. Got it. What about that other one, permethrin?
Permethrin is excellent, but it works differently. Permethrin is an insecticide, and it's meant to be applied only to clothing and gear like your boots, pants, socks, tents, backpacks, not directly on your skin.
Only on clothes and gear. Why?
It binds well to fabric and lasts through several washes, providing long-lasting protection. And it actually kills ticks on contact rather than just repelling them. So treating your outdoor clothes with permethrin adds another strong layer of defense.
Okay, that's a powerful combo. Permethrin on clothes, DET, or picaridin on skin.
Exactly. Now, step 4, and this is arguably the most crucial one. Diligent tick checks.
Checking yourself after being outdoors.
Every single time you've been in a potentially tick-infested area, yourself, your kids, your pets, ticks love warm, moist, hidden spots. So you need to check thoroughly.
Where specifically should we look?
All over, but pay extra attention to. In and around your hair and scalp, inside and behind the ears, under the arms, inside your belly button, around your waist, in the groin area, behind your knees, and between your toes. Use a mirror to check hard-to-see places like your back.
Be really systematic about it.
Yes, and do it as soon as possible after coming indoors. Ideally, taking a shower within 2 hours of coming inside is also a good idea. It can help wash off any unattached ticks, and it's a good time to do your full body check.
Okay, check thoroughly, shower soon. Now, what if you do find one attached? Which is bound to happen sometimes if you're outdoors a lot. How do you get it off safely? Because I've heard horror stories about using matches or Vaseline.
Oh, please don't do any of that. Those are dangerous myths. Using heat, petroleum jelly, nail polish, those methods can actually stress the tick and might cause it to regurgitate more saliva, potentially increasing your risk of infection. They don't work and can make things worse.
Okay, good to know. So what is the right way?
Step 5, proper removal. You need a pair of fine-tipped tweezers or a specialized tick removal tool. Grasp the tick as close to the skin's surface as possible. You want to grab its mouth parts right where they entered the skin, not its swollen body.
You're right down to the base.
Exactly. Then pull upward with steady, even pressure. Don't twist or jerk the tick, just pull straight up and out. Twisting can cause the mouth parts to break off and remain in the skin.
And if the mouth parts do break off?
If that happens, try to remove them gently with the tweezers. If you can't get them out easily, just leave them alone and let the skin heal. Trying too hard might cause more irritation. The main goal is to remove the tick's body promptly.
Okay. Pull straight up, steady pressure. What do you do after it's out?
Clean the bite area thoroughly with rubbing alcohol and iodine scrub or just soap and water. Wash your hands well too. You might want to save the tick in a sealed bag or container, maybe with a damp paper towel, in case you develop symptoms later and your doctor wants to identify it or even test it, although tick testing isn't always recommended or readily available.
Okay, that makes sense. Any tips for making your yard less tick-friendly?
Yes, step 6 can be yard management. Keep your lawn mowed. Clear away leaf litter and tall grasses, especially at the edges of your yard where it meets woods or brush. You can create a barrier, maybe 3 feet wide, of wood chips or gravel between your lawn and any wooded areas. This can help reduce ticks migrating into your main yard space. Discouraging deer from entering your yard can also help.
These are all great practical tips. They're not just abstract recommendations. They really are your frontline defense against this incredibly tricky illness.
Absolutely. Taking these preventive steps consistently is the best way to reduce your risk and enjoy the outdoors more safely.
Okay, now let's shift focus and bring this all together by looking at Section 4. Bella Hadid's battle, a personal story of chronic Lyme. This is where we really see the human face of the disease, especially that chronic, debilitating side that can persist for years.
Exactly. Bella Hadid's experience provides such a powerful, and because she's so high profile, a very visible example of just how persistent, challenging, and often profoundly invisible Lyme disease can be, especially in its chronic forms.
It really does. Her story takes it from being this clinical description we've been discussing with stages and symptoms
Mm.
to a deeply personal narrative.
Hmm.
It highlights those invisible struggles that so many people face, often behind what looks like a perfectly normal or even glamorous exterior.
It's a stark contrast, isn't it?
It really is fascinating, kind of sobering, to think about how someone operating at the absolute pinnacle of their demanding career manages a condition that, honestly, many people still barely understand, let alone have to live with every single day.
Mm.
Her journey really started becoming public knowledge around 2015, is that right?
That's when she first publicly revealed her diagnosis, yes. And significantly, she did it alongside her mother, Yolanda Hadid, and her brother, Anwar Hadid, who both also suffer from Lyme disease.
The whole family. Wow.
That collective family experience immediately made a huge impact. It showed this wasn't just an isolated case, but potentially a shared, maybe even generational struggle within their family. What's really fascinating, if we connect it back, is how their shared experience highlights that insidious nature of Lyme, how it can start subtly, build over time, make diagnosis this really long, drawn-out journey.
And Bella herself, she didn't just get sick recently, before 2015, right? She said it started much earlier.
Correct. She's been very open about the fact that she started experiencing symptoms back in her adolescence, around the age of 17.
17, so years before the public knew.
Many years. It points to this long, silent struggle that was going on well before she ever spoke about it publicly. It underscores that this wasn't some sudden illness that popped up. It was a battle that had been brewing and impacting her during really formative years and the very start of her demanding career.
That adds another layer entirely. So what specific symptoms has she shared? How do they align with what we've been discussing about late stage or chronic Lyme or PTLDS?
She has been remarkably candid, really vulnerable about the huge range of symptoms she's endured. And unfortunately, they align almost perfectly with those really debilitating aspects of chronic Lyme we talked about.
Like the cognitive stuff, the brain fog.
Yes, absolutely. She's spoken frequently about dealing with severe brain fog, really significant memory problems, and just profound difficulty concentrating. She's described days where her mind feels completely clouded, making things that require focus, like reading a script for a job, taking direction during a photo shoot, even just holding a normal conversation, incredibly challenging.
I can't imagine trying to work at her level feeling like that.
It's hard to fathom. And then there are the physical symptoms. She battles extreme, incapacitating exhaustion, that deep fatigue we discussed that goes way beyond just being tired. She deals with persistent headaches, widespread joint pain, and those deep, achy feelings throughout her body.
And these symptoms aren't constant, right? They can flare up.
Exactly. They can fluctuate wildly. She talks about having good days and bad days, unpredictable flare-ups where everything gets much worse. But even on the good days, there's often this constant underlying level of discomfort or limitation she's navigating.
And beyond the physical and cognitive, living with something like that, especially when it's invisible and maybe not always believed by others, must take a huge mental and emotional toll, too.
Oh, absolutely immense. Bella has also been open about her struggles with chronic insomnia, just not being able to get that restorative sleep her body desperately needs, which of course just makes the fatigue even worse.
A vicious cycle.
Totally. And she's spoken candidly about experiencing anxiety and depression as well, which is incredibly common for people living with chronic illnesses. Sometimes it can be a direct physiological effect, the inflammation or the bacteria affecting neurotransmitters. But it's also, understandably, a profound psychological response to living with a condition that impacts every single aspect of your life, that's often invisible, and that can be met with skepticism or a lack of understanding from the outside world.
That lack of understanding must be incredibly isolating.
Hugely. She has vividly described how all these symptoms directly impacted her ability to do her job, which is incredibly physically and mentally demanding. Recounting days where she felt terribly unwell, utterly exhausted, maybe in significant pain during high-pressure photo shoots or walking international runways, having to just push through that immense internal struggle to meet her professional obligations. The contrast between that polished, perfect public image and her private, ongoing battle is just incredibly stark. It really drives home the point about invisible illness.
It really is a profound lesson in empathy, isn't it? Understanding that beneath those curated images, those seemingly perfect lives we see on social media or in magazines, there can be these immense, silent, personal struggles going on. She's basically putting a very famous human face onto a complex medical challenge that often feels quite abstract or distant if you're not directly affected by it. How has her condition impacted her life and career more broadly, navigating it all as such a public figure?
Well, her journey just powerfully highlights this whole concept of an invisible illness. From the outside, as you said, she often appears perfectly fine. She maintains this incredibly demanding schedule, performs at the absolute highest level in a notoriously tough industry. Yet internally, she's fighting this constant, exhausting battle against symptoms no one else can see.
And that difference, that gap, is key.
It's precisely why her story resonates so much. It directly challenges that very common, often harmful assumption that if someone looks okay, they must be okay, which we know just isn't true for so many people with chronic conditions.
And she hasn't just suffered silently, right? She's used her platform.
Yes, very much so. She has powerfully and I think courageously used her enormous platform, especially Instagram and other social media, to raise crucial awareness about Lyme disease. She shares these incredibly vulnerable moments, gives glimpses into her treatments, the IVs, the doctor visits, the sheer reality of living with a chronic illness day to day. She actively works to educate her millions of followers.
So turning her struggle into advocacy.
Exactly, transforming her personal struggle into a really potent public health advocacy effort. And that kind of transparency from someone with her reach is just invaluable. It helps chip away at the stigma, the misunderstandings, the isolation that so often surround chronic illnesses. It opens up conversations that maybe used to be whispered or not had at all.
So what do you see as the broader significance then? Her sharing these really personal, often painful details about her long fight with Lyme. How does that ripple outwards? What's the bigger impact?
If we really connect this to the bigger picture, Bella Hadid's openness fundamentally shifts the narrative around chronic illness. It helps move it out of the shadows, away from being a whispered secret or just a private burden, and into the realm of a widely discussed, acknowledged public health challenge.
Making it okay to talk about.
Yes, and demystifying it. Her story helps demystify Lyme, but also other complex chronic conditions by showing unequivocally that they can affect absolutely anyone, regardless of their fame, their wealth, their perceived health or strength. That is profoundly valuable.
And for others suffering.
For the countless other people out there who are struggling with similar symptoms, maybe undiagnosed, maybe dismissed, maybe feeling completely alone and misunderstood for years, her public battle offers immense validation. It gives them a sense of solidarity. It tells them, you're not alone. Your experiences are real. Your struggles are seen. That is incredibly powerful.
I can only imagine how much that means to people.
And beyond the personal validation, her public advocacy absolutely has the potential to drive broader conversations among the general public, reduce the stigma associated with these conditions, and critically, hopefully, encourage more funding and more research into Lyme disease, into PTLDS. These are areas that are still desperately in need of better diagnostic tools, deeper scientific understanding, and more effective, reliable therapies. Her voice really amplifies that urgent need for progress.
It's a remarkable use of her platform, turning personal hardship into potential progress for many. As we bring this really detailed deep dive to a close now, let's just quickly try to synthesize the absolute key insights we've uncovered today.
Okay.
We've definitely seen that Lyme disease is way more than just a tick bite. It's this multifaceted bacterial infection caused by that incredibly adaptable spirochete Borrelia burgdorferi.
Right, the master of disguise.
Exactly. And it's stealthily transmitted by those tiny exodes of ticks. We learned it presents with this incredibly broad, chameleon-like range of symptoms. It can start with that EM rash, though not always, and flu-like illness,
The early stage.
but can progress to really debilitating chronic conditions affecting the joints, the nervous system, even the heart, if it's not caught or treated effectively.
And we really hammered home how crucial early diagnosis and prompt antibiotic treatment are. That offers the best shot at a full, swift recovery.
Definitely.
But we also dove deep into that complex, often frustrating reality for some people who experience persistent symptoms, grappling with post-treatment Lyme disease syndrome or PTLDS.
Yeah, the area where the answers aren't so clear.
Exactly. And that complex reality was brought into sharp focus by Bella Hadid's very open, decade-long journey with chronic Lyme. Her story really underscores both the immense challenges of living with an invisible illness and also the incredible value and importance of patient advocacy in validating those experiences and pushing for greater understanding.
So as we leave you today, deep divers, maybe chew on this. What more can we really learn from the intricate, sometimes baffling challenges of diagnosing and treating Lyme disease, especially when we place it within the broader context of all chronic, often invisible illnesses that affect so many people?
That's a great question to ponder.
And how does that raw public awareness, spurred by courageous voices like Bella Hadid, how does that genuinely shift our collective understanding? How does it drive the essential research needed for conditions that profoundly impact quality of life, but maybe still remain marginalized or misunderstood in the mainstream?
It really encourages all of us, doesn't it, to be maybe a bit more discerning when we encounter health information, to listen more carefully, perhaps, to our own bodies, but also to the lived experiences of others, and maybe to critically question some of the assumptions, even within established medical thinking, when things don't quite add up or people are still suffering.
Absolutely. We really hope this deep dive has spurred some thought about that profound link between public health knowledge, those deeply personal stories, and the vital importance of advocating for a healthier own and others, and just thinking critically when faced with complex, evolving medical information.
Stay informed, definitely stay curious, and keep exploring these important topics.